Welcome to Tar Podiatry instructional videos. This is Dr. Benham David Massaband. This instructional video that you're about to see will show you how to properly apply dressing on an open wound. An open wound or an ulcer is when you have a sore on your skin that is possibly infected or not infected, but you need to cleanse it first. What you do is you get a bottle of normal saline and you copiously lavage or spray the wound for approximately 5 minutes. After you use a clean dry gauze and start at the wound, and you start debriding the inside of the wound if it's not too painful. Basically, with the gauze, you want to go over the wound to get rid of any fibrotic or necrotic tissue, which is tissue that's gray and not healthy. And you want to keep doing that until you see a nice healthy red bleeding tissue, but do not be aggressive. Afterwards, use a gauze to dry the areas around the wound, but make sure you do not contaminate or recontaminate the wound. Make sure you get between your toes. You don't want any moisture between the toes. If there are debris still present, you can use the saline again to wash the area. Whatever wound dressing you use, you want to put some ointment on the gauze. You don't want to use too much because that will macerate or keep the wound wet. You want to put a small amount over the wound. And again, make sure you do not touch the wound with your hand, and make sure you wash your hands before and after you perform this. After you put a couple of pieces of gauze, then you take a gauze roll and roll over the foot. Anytime you're using gauze roll, ace bandage, or anything, you always want to start at the forefoot and go up. Never start at the leg or ankle and go down towards the toes. Always start at the forefoot and go up. If the wound is not on the toe, keep the toes open. This way you can check for circulation and make sure the bandage is not tight and there's no creases on the bandage. As you can see, the bandage is being rolled on the foot. She's not pulling on the bandage itself because that will make the bandage tight. It is very important that you do not make the bandage too tight because that will cut off your circulation. She's laying down the gauze and slowly going up around the ankle. This procedure should be done at least minimum once a day or twice a day. Consult your physician as the number of times you should do this. And it's best to avoid tape on skin. So make sure once you finish rolling the bandage, the tape only goes on the gauze and not on your skin. This way it will avoid future sores